Okay, just a quick little protocol for knee pain, and this is for you, Zach. There are lots of things you can check for knee pain. If someone's got direct trauma, the most common is anterior cruciate ligament, playing sports and you've been hit from the side. That's obviously direct trauma. But when someone's got knee pain, they can't tell you that anything happened, it just starts to hurt. Just a couple of things you can look at quickly. Okay, flexibility. Okay, how flexible is someone's hip flexors? Okay, so very easy test standing up. Okay, keep the legs in line. Can you lift up your foot? Yeah, and pull your heel towards your bum. Okay, so you want to keep them in a straight line. Okay, can the leg go to neutral? I can help. Yeah, that's not a tight hip flexor. You can also do the Thomas test on the table if you wanted to, but clear flexibility. Okay, the next thing you want to test is stability. So if you face the camera for me. Okay, you guys know this, feet together. Okay, lift up your right leg. See if they can balance. Okay, you can get them to close their eyes. Okay, it makes a difference. They should lose about 50% efficiency, and relax. Try the other side. Okay, and just see if there's a difference. And very often the wobbly side means they've got a stability issue. Okay, the next thing you test for is strength. Okay, so if I can get you lying on your back for me. Okay, lots of ways to test strength. This is the way I do it. Bend your knees. Okay, push your hips off the table. I'm just going to do one. Right, lift that leg, just touch my knee. Or touch my hand, sorry. Okay, that's not too bad. The pelvis stays pretty straight. But if someone does that, they lose control. It's a strength issue. Okay. The next, and relax. The next test you can do for strength, and I'll do it quickly. Can you go back a bit there? Is the lunge. So I lunge this side, I lunge and my leg caves in. That is demonstrating that the muscles in my pelvis, my hip, are not controlling the femur. Okay, it's collapsing. And look, that's the position that a lot of people hurt themselves when they're playing tennis or sport. They start to get knee pain, or worst case scenario, they tear something. Okay, so for people that do have knee pain, I'll show you a couple of exercises that can really help. Okay, strengthening, hands down. Okay, push your hips up. Okay, keep your pelvis nice and stable, and I want you to march. So one leg comes up and down. Very good. And the glutes, all the muscles that control the femur, are working very hard. Okay, first of all to stabilize the pelvis, and secondly to keep the femur in a straight line. Okay, and very easy to see here. Look how they turn on. Fantastic, rock solid. Okay, so that's number one. Second thing, if you find a lot of tension here, very often it's reciprocal. This is tight because this is weak. So you can do soft tissue work here, but please make sure that you turn on the glutes. When the glutes turn on reciprocally, the hip flexors will start to relax. Okay. The next thing you can do is teach them to become hip hinges. Okay. So can you stand for me, please? And it can be done in exactly this way. Let's say the pain is on the right hand side. Okay. So you can use the table to stabilize. Alrighty, I want this foot going back. Okay, you can hold onto the table with your left hand. Okay, and all I want you to do is lean forward and hinge at your hip, not your knee. There. Okay, come up. Try and touch my finger with your bum. Stick it back, there, and up. Lean forward, let your whole body go forward. Lean back, sit back, there we go. Lean forward and sit back there. Okay, so we're getting most of the movement occurring at the hip, as opposed to knee dominant, go straight down. That is not good for a knee. Yeah? Teach people to use their hips and not their knees. Go down using your hip. Stick your bum back, Fantastic. Okay, so just a couple of tips for knee pain sufferers. Thanks.